practitioners so that they do not enjoy same benefit with other races when claiming for healthcare services rendered. And moreover, there were allegations of fraud, wastage, and abuse in the medical schemes system. Honorable members, the purpose of today's meeting is to receive the progress made thus far regarding the implementation of the findings of Section 59 report, which has been done since there were allegations of racial profiling and lack of transformation. Lastly, we will receive presentation by the Department of Public Service and Administration on the success and challenges regarding the implementation of government employees' housing schemes and its savings rather. With those few words, let me allow the Honorable Minister or Deputy Minister, if the Minister is not in attendance, to make his or her remarks before the presenters. I now invite the Honorable Minister.
Good morning,
Thank you,
Chair.
Chairperson.
Minister apologized yesterday. Oh, sorry, DM.
Thank you, Chairperson. Good morning.
Good morning, DM.
Let me first start by acknowledging you, Chairperson, and the members of the Portfolio Committee and the public at large. Also acknowledging the officials from the Department of Public Service Administration present here with us this morning. To say that the Minister has actually apologized that he wouldn't be in the position to come and join us today in this Portfolio Committee meeting. But your introduction has briefly touched on the business that will actually be conducted today, which indeed is what we will be doing. What I want to just actually also indicate is that we will, besides GEMS, be looking at the Government Employee Pensions Fund. The briefing will be on challenges regarding implementation of the Government Employee Pension Scheme. And with the Government Employee Pension Scheme, one of the major challenges that we are currently busy with that may actually to some extent also want us as a portfolio committee to also liaise with the Committee for Finance is pulling out of South African Home Loan, which was an entity that was actually preferred by the chamber that is labor and public service to actually provide access to housing for public servants, with the hope that it was actually going to be in the position to manage to allow public servants to easily and in an affordable manner access housing without actually having to comply to a number of requirements that are actually found across the board in all financial institutions. But what is unfortunate is that SA Home Loan continues to operate as a financial institution, which is what we need to look at and try to fast track in terms of getting out of the service level agreement so that we can anew look at a way of actually making it possible and easy for public servants to manage to access housing. I'm not going to be talking too much about GEMS because what you've actually indicated is what you're going to be putting your lens on in terms of GEMS. But to say, regardless of the negativity of the report that has been alluded to, in general, the scheme is actually running at its maximum potential. And they actually have even managed to have some kind of surplus in the previous financial year, which is something that is actually positive that we need to look at. But I will allow the DG to actually make a presentation on the two, so that the committee can be briefed in a way that is very informative. I thank you, Chairperson.
Honorable Deputy Minister. The first presenter can take the floor. Who will that be?
Thank you, Chairperson. I am Dr. Stan Mulwabi, the Principal Officer of the Government Employees Medical Scheme. But before I do the presentation, I am with the Deputy Chair of the Board of Trustees, and that Fariseni Poppy, who will just do the greetings.
Good morning, Chairperson. I'm Fariseni Poppy, Deputy Chair of GEMS. Thank you very much.
Thank you, Chairperson of the Portfolio Committee. I'm just sharing the presentation. While I do, Chairperson, I would also love to greetings to the members of the Portfolio Committee, and greetings to the DM and all colleagues who are accompanying from the DPSA. I seem to be at the wrong slide. Can I just quickly do this? Thank you, Chair. Can I just check if the presentation can be seen, Chairperson, please?
I see colors of the rainbow.
Thank you, Chairperson. And those colors are what we also try to espouse at the Government Employees Medical Scheme. Chairperson, the purpose, as was said in the introduction by yourself and the Deputy Minister, is to appraise the Portfolio Committee on Public Service and Administration on the scheme's response and implementation of remedial measures to the Section 59 interim report findings. And we do like always to indicate that this was an interim report. We still await the final report. The background to the Section 59 inquiry is that around October 2018, there was a presidential healthcare summit, and one of the biggest concerns that was raised was about the existence of fraud, waste, and abuse in the healthcare industry. And then subsequent to that, the Council for Medical Scheme, which is the regulator, held a fraud, waste, and abuse summit in February 2019. And then in March, there were some reports where some of the healthcare providers were basically saying, well, despite all this report about the existence of fraud, waste, and abuse, they were saying that they do not abuse the medical schemes. And then around May 2019, then there was a advocacy group called the NHCPA and Solutionist Thinkers, who appeared in the media, basically making the allegations that the medical schemes are biased against Black healthcare professionals. In June, then there was the establishment of the Section 59 investigation. The report was released on the 19th of January 2021. The report was shared with various parties, and since it is an interim report, the parties who were subject to the Section 59 investigation were given until the 5th of April 2021 to provide responses to the interim report. And with regard to the Government Employees Medical Scheme, Chairperson, as you have alluded, there was negative publicity generated in the media. And we then basically, as a scheme, came up with a response plan to address the interim findings that merited action. Our response at the Government Employees Government Employees Medical Scheme involved a threefold response, which was intensive healthcare provider engagements. We looked into our fraud, waste, and abuse policy, how it is executed. We looked at the processes, practices. We looked at anything in the database that has to do with the fraud, waste, and abuse. And then started also an engagement process with our stakeholders. Our principal as the Government Employees Medical Scheme being the Department of Public Service and Administration. We engage with the ministry from time to time to give them update on what we are doing. And also any stakeholders like the board, committee members, and with the regular updates on the work we do. And to that effect, we engage with various health provider associations, amongst which there are advocacy groups, they're called solutions thinkers, independent practitioners associations, the South African Medical Association, the dental practitioners, and there's quite a long list. And they also were part of submissions to the Section 59 investigation. We adopted an open door policy, which was also is ongoing. So these engagements with the various advocacy organizations, representative organizations of the healthcare providers, we are continuing to meet them on a regular basis. One of the things we thought it's important just to state is that GEMS is a transformative organization, and we back this with objective numbers to show the GEMS commitment to transformation. The policy principles that drive, that are behind what we say when we say it's a transformative organization is that we are alive to driving the country's transformational agenda in GEMS sphere of influence. We leverage GEMS position as a strategic purchaser of healthcare services, being the second biggest medical scheme in the country and the biggest closed medical scheme for public service employees. We are committed to bring about much needed positive socio-economic transformation in those areas of influence. And we encourage increased participation of Black people as well, the empowerment of suppliers in our value chain. And in thus achieving promoting and accelerating shared economic growth. And we also implement preferential procurement and promotion. And the numbers that I referred to are on the right of the slide, where GEMS beneficiaries, 95% Black. Before the establishment of BLEM, we have over 1 million beneficiaries who previously were not covered coming onto the private medical scheme insurance cover as a result of the establishment of GEMS. In terms of the GEMS employees, 97.3% are Black, 69% are female, and 2.5% are people living with disabilities. And on the procurement side, 42% of those that do business with GEMS are either EME, large enterprises, QSE, and then they also qualify in terms of the Black BBBEE, the generic scores. And then 22% are level 2 EME. And then during 2020, we had 5 of the big suppliers were on level 1. In 2021, GEMS was also a finalist in the APSA Supplier Development Awards. When we establish hospital networks, we ensure that there's inclusion of level 1 and 2 hospital, and there is bias towards the inclusion of hospital serving previously disadvantaged communities, and these are usually Black-owned private hospitals. In terms of the demographics of the officers of GEMS, the Board of Trustees is made up of 67% Black, 33% white. The executives is 64% Black, 18% white, 9% Indian, and 9% colored. Senior managers, 62% Black, 13% white, 21% Indian, and 4% colored. And in terms of gender, we have 75% of the board is male, 25% is female. At the executive level, 55% is female, 45% is male. In the level of senior managers, 58% female, 42% male. So when we talk transformation, these are the objective numbers that we are presenting to say GEMS is indeed a transformed organization. Before I go through, Chairperson, I just the feedback on the specifics. We just thought that we should just quickly define what fraud, waste, and abuse is, because this is what started the whole Section 59. So when we talk about healthcare fraud, we have those that knowingly submit or causing to be submitted false claims against the medical scheme. And this is an intentional misrepresentation of the facts in order to access payment by the medical scheme of a benefit to which one would otherwise not have been entitled. And fraud is a criminal endeavor. And then waste and abuse are those that claim against the medical scheme for healthcare treatment and services that are not absolutely medically necessary, including any form of over-servicing or overcharging of a patient, and that may objectively be considered unethical or unconscionable or contrary to the best practice. And at this stage, I must just mention that fraud is estimated to be about 5 to 15% against the healthcare insurance. And the types of fraud are stated here. We have various types of frauds that we experience as a medical scheme. People claiming, getting admitted so that they can claim against hospital cashback plans. So they were not necessarily sick, just to access those products. There's collusion, there can be collusion between members and the healthcare providers to get cash out of a medical scheme. There can be lots of tests. This is waste, duplicate of unnecessary tests, or there can be exceeding the what is normally regarded as standard practice in terms of consultations, times, and then you can claim more because you spend more time with the patients. And then there's also what we call padding of claims, where claims, because it's a third-party payer system. We have people padding claims, including things that they do not necessarily rendered. And then there's billing of services not rendered as well. So what were the main complaints before Section 59 was established? The complaints were mainly that there was the medical schemes in dealing with fraud, waste, and abuse can be aggressive, impersonal, threatening in nature, and the communication regarding any allegations against the healthcare providers. And also that there's a blanket approach described as a one-size-fits-all, which means that all healthcare professionals are painted with one brush. And we have always said, and I repeat, that it is only a small percentage of these professionals who actually are committing fraud. So it's definitely a GEMS, we have not done that. And then the complaint was, when we investigate fraud, waste, and abuse, there is lack of clinical understanding by the medical schemes. And as a result, the medical schemes are not in a position to can say whether the care that was given is appropriate or not. And then there was also the big complaint of the medical schemes requesting disclosure of confidential information. And on the right of the slide, I've indicated that basically our response was that we make it very clear in our correspondence, so there's no aggression and threatening nature. We make it very clear what the matter is all about, and we deal with each case on its merit, so we don't do a blanket approach. And we have medical practitioners and specialists and people who are clearly aware what is healthcare and what diagnosis, what is the right care of patients when they investigate these claims. So we have knowledgeable officers of the scheme dealing with this. And then when we request information, we do not request detailed confidential patient notes. However, we only request information that deals with the claims. So our response to the GEMS section, to the section 59, in fact, the actions that we have undertaken since the publication of the interim report was that we engaged with the media to explain. We have also established various member education on the various platforms of the scheme to ensure that members understand what is fraud and what is claiming appropriately against the medical scheme. We have also engaged with the healthcare providers, where we had a webinar which was attended by over 500 delegates of the healthcare profession, and we conducted a lot of discussions with those practitioners. And then we have been indicating what our response and reporting in our various platforms on what the GEMS response to the interim report is, and with updates at the level of the Public Service Coordinating Bargaining Council, the DPSA. We have had, as chairperson, we have reported to the Parliament Portfolio Committee, and then we also engage with the healthcare providers. I'm just quickly going to deal with those findings of the interim findings. So one of the interim findings, which is the one that the chairperson mentioned at the beginning of the introduction, the detection systems, this is an interim finding, employed by Discovery GEMS and MedScheme, use algorithms to flag providers as so-called outliers. Now, this is where the main the main thing that was there in the media comes out of, the one that says there's bias against healthcare providers. However, one of the things that was said is that it was clearly said in the interim, while there is this outcome that comes out of these algorithms, there wasn't evidence to show that this was intentional. And I think this is one thing that basically always is not mentioned. So one of the things that came out of the report was that, however, while there is automation in the operation of these algorithms that identify the outliers who end up being investigated for fraud, waste, and abuse, there's always an element of human intervention at some point along the chain of investigation. Maybe that may introduce bias. So what we did at GEMS, we looked at this, and we looked at the system that is being used, and there is no inputs into the systems which have anything to do with race. All the work that is done in this algorithm have to do with input of practice numbers, and the race is not introduced. However, what then also we did is that we strengthened where there has got to be human in our standard operating procedure. What we did is that we strengthened the level of expertise for those who have to do analysis at the human level, the human intervention that is being referred to ensure that whatever the outcomes of who is to be investigated must be informed by expertise. And we have very senior people who are now looking at these outliers before it can be decided whether a case needs to be investigated further. And then one of the interim findings, according to the Section 59 interim report, was that all administrators request confidential patient information from providers, but the justification for the request varies between the various schemes. The request for patient information can then often spend many months and even years So at GEMS, what we have done is that we request beneficiary information to verify whether the services have been rendered. We do not ask for confidential patient notes. And this matter, we also referred to the HPCSA, which is the Health Professional Council of South Africa, ethics guidance notes, just to make sure that we are within what is acceptable, having due regard for the Section 59 interim report. So we also make sure that the period covered by the information does not have to be a very long period. And with the implementation of the POPI Act from July last year, we have also ensured that there is training sessions for our employees to ensure that we also comply with the POPI Act. And when communicating with healthcare providers, our letters are now specific to who we are talking. They are as concise as possible, and they only ask for the information that is absolutely necessary. And the review process, we try and make sure that it is looking at a shorter period because it was saying that this spans over many years, and we're looking at the 24-month period. And then the other interim finding, the complaints of racial discrimination must be taken seriously by the schemes and administrators. This is a comment from the report. In order to understand how normative systems create unfair consequences, it is necessary to consider the position of the people who are telling you it's not working for them. And this is the reason why we have already started doing work. We were responding to this recommendation from the Section 59 panel. We regarded the complaints in a serious light, and hence we started engaging with the healthcare providers, as I have explained earlier. And we, as a scheme, the progress update is that we've been active through extensive stakeholder and media engagement to ensure that the stakeholders receive factual information about the investigation and the role that we at GEMS have played in reducing inequality. And this is basically through the engagement that we have had with the healthcare providers, and we have reviewed, as I indicated earlier, the policies we have reviewed and looked at areas where the interim report suggests that we should we can do it a bit differently. So the GEMS Claims Fraud, Waste and Abuse Awareness Communication Strategy and Plan was developed, and we adhere to wanting to be a good corporate citizen. And some of the work that we are doing, it is really related to that ideal. And then there was also the interim finding that any amount when fraud or waste or abuse has been proven, and then there is a need to claw back the money from a healthcare provider. The recommendation in the interim findings makes the statement that any amount which is clawed back by a scheme, it must be reasonable and must be based on a methodology which is reasonable. So what we are saying in terms of reviewing this, we said GEMS quantification of a forensic debt, so it is a proven debt, follows a systemic process, and it's based on the findings of investigations. It's not just deciding that this was fraudulent. There are processes that are put in place to prove that this is debt that results from fraudulent claiming against the scheme. And where we make estimations, this is backed by facts and the circumstances surrounding the practice, but we always ensure that there is supporting information from a practice to determine what the debt of that practice is. And then what we did, we revised the debt management policy. The changes were mainly intended to bring about alignment with the policy changes that we are making, and also ensure that we only use best practice in our debt recovery, as this was highlighted in the Section 59 interim report. The policy is now aligned with best practice, and what we do in terms of before we enter into a debt recovery process with the healthcare provider, we perform an affordability test, looking into the personal circumstances of the debtor, while we ensure that the obligations of the scheme are always met. And the obligations here of the scheme is that if there has been fraudulent claim against the scheme, then the scheme is obligated to recover those fees. Chairperson, in conclusion, having gone through the steps that we have taken since the findings of the interim report, we just want to repeat that GEM supports economic transformation, and this includes prevention, detection, and responding effectively to corruption and fraud. And in responding to the Section 59 inquiry interim report, we acknowledge that we exist in a country and a society where inequality still prevails. Our aim at GEMS is to create and preserve the value of the GEMS and stakeholders, and to avoid erosion of this value in the health ecosystem and broader society. We will continue at the Government Employees Medical Scheme in the process of introspection and address any operational deficiencies. And we have done that largely relating to the Section 59 inquiry interim findings. GEMS is committed to playing our role in addressing systemic inequality through leveraging stakeholder relationships. And in this case, the relationships that we are talking about are those with the healthcare providers. And there are those who said they have been found to have claimed wrongly against medical schemes because they do not understand the process and they are new. We have committed to ensuring that we train the new providers on how they can claim against the medical schemes, so that they may not be found to be taken to have committed fraud. And we have committed ourselves to improved communication with healthcare providers to ensure that we do not have these allegations that are coming, which were very unfortunate. Chair, we don't know when the final report will be released, but we await the release of the final report. And once it is released, we'll study the report. And as we have done to the interim report, we'll respond accordingly. Thank you, Chairperson.
Thank you. That concludes your presentation, isn't it?
That is correct, Chairperson.
Thank you. Honorable members, I want us to get the second presentation and then discuss those two reports together. After that, we go to the last item. If you are agreeable to that proposition.
Yes, we are.
Agreed, Chairperson.
Okay. Thank you very much, honorable members. Can I invite now the Honorable Deputy Minister?
May I take the opportunity, Chairperson, to invite the DG to present the second report, which will be on government employee pension fund, government employee housing scheme. I'm sorry. Thank you, Chairperson.
Thank you, Honorable Deputy Minister. You can take the floor, presenter.
Thank you, Chairperson, and good morning to members of the Portfolio Committee. Good morning to the Deputy Minister and colleagues who are in the meeting. Chairperson, the Chief Director for macro benefits at DPSA will be presenting Mr. Dumisani Nkwamba. However, whilst he's setting up, I just want to highlight that the work that we are doing on the government employee housing scheme has also been affected by the discussions and the resolutions of the public sector summit that we held between Labour and government in March 2022. And one of the decisions of the summit was that there is a need for a new institutional form to drive this work of the government employee housing scheme. There is also a need for new packages that are friendly and affordable to employees in terms of the housing scheme that we are having, the packages regarding home loans that are available. And this is the work that we are currently engaging in with Treasury, GPF, as well as the human settlements. GPF as an interested investor in terms of the work that we are doing with the government employee housing scheme. We have been given a period of a year to focus on these areas and be able to deliver on them. So I just thought I need to highlight that there are changes that will be happening, and we are working around it and rolling out the system in relation to that. Otherwise, having given that brief update, I will then hand over to Dumisani, who will take the committee through the areas that they wanted a briefing on. Thank you, Chair.
Thanks, DG, Chairperson, and all members of the Portfolio Committee, Deputy Minister. Good morning. I was trying to share the video so that members of the committee can see who is presenting. Chairperson, the presentation will focus on 3 areas as per the request of the committee. That is GHS successes, savings, as well as challenges in the implementation of the government employees housing scheme. The first area that we'll be dealing with, Mr. Chairperson, is the area regarding GHS savings. I seem to be struggling with the system, but I'll just continue to present. Hopefully it will come back to normal health. The first area that I'll be dealing with, Mr. Chairperson, is the area regarding GHS savings. Prior to the signing of the PSCBC Resolution 7 of 2015, of course, government employees were receiving housing allowance, but then such housing allowance was not directed to purchasing homes. And therefore, the signing of the agreement allowed the introduction of the individual linked savings facility, which has now created a culture of savings by public servants. A number of public servants utilize this facility to save towards home ownership. In other words, once there is enough in the savings, they are able then to follow all the GHS processes, withdraw, and then secure, buy a home or build a home. And as at 31 March 2022, a total of 14 billion rand was saved in the ILSF by approximately 210 public service employees. And I must indicate that the savings facility itself, Mr. Chairperson, is managed by the National Treasury on behalf of the GHS. The other important factor to mention is that an amount in excess of 300 million rand is being deposited into the ILSF monthly by public service employees. And as I indicated, this is solely for them to assist them when there is enough in their savings to be able to buy a home. A further 700 million rand, it's worth indicating, that has been forfeited by employees due to non-compliance with the PSCBC resolution, as I indicated, which made it clear that if an employee is dismissed or resigned from the public service, such savings are forfeited. So currently, there is an amount standing at 700 million rand, which has been forfeited by employees. The GHS has appointed a service provider to this end to conduct research during this financial year on the possible effective use of the savings and forfeited funds to the benefit of employees. Such findings, of course, will be presented to the DPSA Executive Committee and the PSCBC Working Committee that deals with the GHS matters. But just to stress that whatever the outcome is, such an outcome will have to be governed by processes in relation to the Public Finance Management Act, the PFMA. In other words, the Treasury makes final determination on the matter. And I must apologize, Chairperson, my system has frozen, so I'm not able to run the presentation, but I will continue to present. With regard to GHS successes, many government employees are aware of the GHS services through information and outreach sessions, which we conduct countrywide with national and provincial departments, as well as certain entities that are governed by the PSCBC. And whilst there are many challenges, Mr. Chairperson, it is worth noting, as the DG indicated in her opening remarks, that there are certain measures which are being implemented to rebuild the scheme. It is worth noting that during this brief period, from 2015 to date, provision of housing access to government employees has improved. And just to take you through this table, housing allowance amount in 2015 was 900 rand, and it continued to be increased, and to date is 1,500 rands. Employees eligible but not receiving allowance, housing allowance, which is a cost of concern. In 2015, it was 305,000, and now it's 200,000, which is still extremely high. It's a matter that ourselves as a GHS team, we've embarked on a particular campaign to speak to those departments where there is a high number of employees who are eligible but not receiving such an allowance, to ensure that this anomaly is corrected. Employees receiving old housing allowance, there has been much progress here. In 2015, it was approximately 45,000, but now as at 31 March 2022, it's 6,457. Employees receiving housing allowance as homeowners, there has been much progress there. In 2015, 353,000, to date, 744,000. Employees receiving housing allowance as tenants, and even here, Mr. Chairperson, there has been some progress. In 2015, 570,000, but to date, it's just under 210,000. The current funding arrangements, Mr. Chairperson and members of the committee, of course, involves the SA home loans, and in partnership with the GPF, PIC, and ourselves as DPSA. And to that, we are able to report that in this current arrangement, around 25,000 government employees were assisted with home loans based on the current partnership, and were able to break it down in terms of mortgages, 23,000, housing access loans, just under 1,700, and in total 24,817. There is the matter of the enrollment system, which is very key, critical to the functioning of the GHS. The enrollment system allows the scheme to profile employees and be informed of their current and future housing choices or solutions. And to date, or as at February 2022, 458,126 employees were enrolled through information gathered during information sessions and inquiries received. The GHS embarked on a process to identify government employees who forfeited their savings, not through a fault of their own, but due to HR processes in departments failing them. To this end, the department has approved, following submission of names by national and provincial departments, to pay out those employees who were disadvantaged because of HRC processes. This will obviously require as well concurrence from the National Treasury, but from the department DPSA side, that process has been cleared by the Director General. The third important point, Mr. Chairperson and members of the committee, is the Memorandum of Understanding that was entered into by the department and the National Housing Finance Corporation with regard to the subsidy, which is offered generally to citizens in the country, but the memo extends that kind of subsidy program to government employees. I need to indicate that just to cite an example, if an employee is earning 3,500 rands, the subsidy that will be made available to such an employee would be 121,000 rand. So those who are earning between 3,500 and 22,000 rands per month, they're eligible for the FLISP subsidy. And as I indicated, the Memorandum of Understanding is already in operation as signed off by the department and the NHFC. The other important measure of success, which deals with employee indebtedness as well as attachments to salaries of employees who are highly indebted. There is a program that we are working together with the National Treasury to assist employees in this regard. And then there is also an important factor, the introduction of home access loans, which have made it possible for employees to build their own houses, especially in the PTO, that is the permission to occupy space in rural areas. So that has been done. Commercial banks do not assist those who want to build in rural areas, and we have many public servants who work in rural areas, and this program has allowed them to build their own houses through the home access loans. The next area of a challenge, Mr. Chairperson, I suspected very much that the video blocked the process of presentation. I've now switched it off. The next challenge, Mr. Chairperson, is the issue regarding the form of the GHS as is. Currently is a directorate within the branch negotiations, labor relations, and remuneration management. I need to indicate, as the Director General stressed, that the in-house model poses some kind of challenges, but it's a matter that is being attended to following the Public Service Summit to review the institutional form of the GHS processes that may lead to this scheme to be a government component. The other area of challenge, interaction with employees through the enrollment system, information and outreach sessions, has exposed a high level of indebtedness of employees, which impedes access to home ownership. And GHS is looking at opportunities to address this challenge. As I indicated, the National Treasury is also partnering with us to deal with this particular challenge. The most difficult area, Mr. Chairperson, is that the current funding model that we have with SA Home Loans through the arrangement with the PIC and the GPF has not been able to resolve the issue of high interest rates. So in a way, it defeats the purpose of assisting government employees to access affordable homes with better interest rates, but we have not been able to deal with this matter. But there has been an undertaking following the Public Service Summit held in March for engagement by the PSCBC Working Committee with the GPF and the PIC to deal in particular with a new funding model which will ensure that we're able to deliver on our mandate as signed off or as agreed back then in 2015 in line with the Resolution 7 of 2015. The poor implementation of standard operating procedures on the administration of enrollment applications and housing allowance applications by HR practitioners in national and provincial departments is a case of concern, but the Director General, as I indicated, there are circulars which we issue to departments to deal with this kind of challenges that we face time and again. Due to capacity constraints, this is another area of challenge. The GHS is unable to verify savings withdrawals as they are submitted directly to National Treasury, notwithstanding the fact that we do engage with the Treasury time and again to monitor and assess this area. And then the other challenge, there is no verification system to ensure that savings released under permission to occupy applications are indeed utilized to build houses in rural areas, despite the requirements that funds should be utilized for building within a period of 12 months. And then there is also an issue of typology of houses suitable for government employees on salaries level 1 to 6, which is an area that we have initiated a process and engagement with the Department of Human Settlements. And of course, the issue regarding trust deficit, it's an issue that has been somehow resolved following the the Public Service Summit held in March. In terms of conclusion, Mr. Chairperson and members of the committee, as a way forward, the role of the GHS Consultative Committee at the PSCBC in addressing the current challenges is very critical. They are playing a central role, of course. And then the issue, without me repeating, the issue of the institutional form is being attended to at the highest level of the department. The last point is just to indicate that the development of a roadmap that will set out a clear path for the GHS, including transitional measures leading to the termination of a service level agreement with SA Home Loans. That process is underway and the roadmap has been considered. And the last point, as I conclude, the success of the GHS supporting employees to utilize their housing allowance towards home ownership depends largely to a large degree on affordable home loans that they can access from financial institutions. And as such, the undertaking by the PSCBC for a new funding model, negotiating or engaging with the GPF and the PIC will be very critical in this regard. Mr. Chairperson and members of the committee, thank you. That will be the end of the GHS presentation.
Thank you. Is the next presenter ready?
That was the last one, Chair. Thank you.
Oh. My counting is not good today. Okay. Honorable members, I now open for discussion the two presentations. Let me note hands. I see the Honorable Deputy Minister, Honorable Nduli, Honorable Kibi, Honorable Mutsipe, Honorable Maneli, Honorable Mkweba, Honorable Gondwe, in that order.
Thank you, Chairperson. Mine is just to say that these are the two reports that you are actually putting before the committee. In terms of the second report on the government employee housing scheme, to say that the idea of appointing a service provider for IFLS is just a mooted idea. It has not been finalized yet, as much as the idea of actually also bringing in the presidential infrastructure program on housing. Thank you, Chairperson. Is Chairperson still there?
Yes, I've been calling you.
Chair, can I come in? It's Mandul.
I've been saying so. Come in, Honorable Nduli.
Thank you, Chair. Chair, firstly, I would love to welcome the presentations, both presentations on GEMS and government housing scheme. Now, I wanted to discuss, to ask some few, can I please switch my, seemingly, I don't know what's going on with network here. Okay, if the chair can allow me to.
The request is granted.
Thank you. No, Chair, I wanted to ask something from James to say if James can tell us as to initial, what is it that was lacking that led to the inequality? Maybe was it the health providers didn't have the same background? If so, was there any platforms for them to have uniform or standard courses or training? Secondly, Chair, after the complaints, all the complaints, what does now James have that the yardstick that assists them to check the status, whether now the status is running smooth in terms of fair treatment or equal treatment? Another one is that maybe according to the problems, maybe can James maybe tell us maybe the specific parts that have been improved in terms of the complaints, and that they attested to that they are working? That was for James. For
government housing scheme, I wanted to check something. What happens to a member that had applied and then get perished, maybe due to COVID or any other thing, get perished? Bearing in mind that this member has been contributing and the application was not yet through, what will happen in that regard? Look, a GA that has been staying with his or her kids in a settlement, informal settlement. Now, with that excitement that we are now going to have a better housing, what happens? I heard the presenter talking about forfeiting, and maybe one would love to get the clarity in that regard as to how can you forfeit something that you've been contributing, and maybe in the terms of forfeiting, if they can elaborate as to how are they viewing that and how do they see as a solution. Lastly, Chair, or not lastly, the other one, Chair, now is the backlog of housing allowance. Now, do they have the strategy now to overcome that? And lastly, the old and new allowance. The presenter said the allowance is increasing. Now, but people are still getting the old ones. Now, can you elaborate on that one as to why holding on the old one, whereas the new one has been approved? Thank you, Chair.
Honorable Kibi.
Thank you, Honorable Chair. Good morning, Chair, Honorable Member, the Deputy Minister. Honorable Chair, let me also join Honorable Julie in welcoming the two presentations. Honorable Chair, I've been well covered by Honorable Julie in some of the questions that I wanted to ask. But I also want to get to the medical scheme, just to hear from the presenter whether in the situation where they found out during the investigation that there are claims that were made for services that were not rendered. Now, I want to know, maybe in their investigation, was it found that there are health practitioners who did that with the patient or with the patient or the person that they claimed on behalf of? I want to get clarity on that one. And what is the turnaround times of processing claims for healthcare providers? And what is the current backlog of payment of healthcare claims? If they can just categorize in terms of race, one would appreciate that. My next one is also, after the release of the Section 59 report, did GEMS investigate and reprimand officials who were found to be behind the racial profiling, as we are getting it that there was also this racial thing. And on the allegations that the schemes and administrators unfairly discriminated against Black providers and use racial profiling in the implementation of Section 59 of the Act. What has been improved to change the situation or the status quo? On housing scheme, Honorable Chair, can the presenter please give us details regarding the 700 million forfeited by the employees due to non-compliance with PSCBC, Resolution 7 of 2015? Why is it a savings and also forfeited to the state? My next one is on service provider to conduct research on the possible use of ILCSF savings to the benefit of employees. I just want to get clarity on, will government and the department honor the recommendations by a service provider to conduct research during this financial year on the possible effective use of individual linked savings facility and forfeited funds to the benefit of the employees? My last one is, why are there still employees receiving old housing allowances as at the end of March 2022? Can this not be reviewed and rectified? I thank you, Honorable Chair.
Honorable Mutsipe, take the floor.
Thank you very much, Honorable Chairperson. And I also like to welcome the presentation and also like to welcome our DM.
Honorable Mutsipe, you are breaking up. We don't hear you.
And all our honorable colleagues, and then all the presenters here for gems of my video. Then all the presenters is DPSA. Like the board members, we received the report from that the board members. What I want to know about the board members is, do you have disabled people? Because that was never mentioned when the report was given, that we had only the race was mentioned, but how many disabled people do we have as board members was not said. Maybe can we have clarity on it? And then the second one is, there is a tendency that is made by the pharmacy that is reducing tablets in the package boxes. Instead of getting 30 tablets, we only received 10. And then 20 was reduced from the boxes. And if you cannot read or notice it, will be gone just like that. So I want to know, and if it happened that you discover that your tablets are being reduced while you are at home, and when you go back to the pharmacy, they always say that it is a mistake. So this issue is happening in the local pharmacies. So I'm requesting that this must be investigated in order that this must be reduced, because I'm taking it as a fraud. It's like a fraud because they are stealing from the client. So this must be followed up. I'm asking this to be followed up. And then the other thing is on the report, it was said the GEMS used to have more than 1 million members. So I want to know what happened. What happened to those people that led them to leave the GEMS? What was the problem for them to leave this medical scheme? And then the other thing is, network. Let me go to a housing scheme. Here it was spoken about the savings. So according to our knowledge is that when you save, it's something that you are going to get maybe by the time that you are due to it. But when you are forfeiting it, I don't understand why must you forfeit it. Maybe here we must also get the whole clarity. Why should you forfeit? Because you have been saving the money and you know that at this point in time, I will be receiving it. And then even the money that was saved, there is a saying that you forfeit by the time you resign or by the time you leave, you resign, or you have been fired from work. So I'm asking, what about those people who has passed on and then they have been saving the money before? So are they also forfeiting that money, or what is happening? And then the last one is, what is the consequences that is being taken to the HRs who did not do their work in order that the employees must not get their money? So what was the steps that have been taken for those people, for the HRs who didn't do their work and the employees resulting in forfeiting their money? Thank you very much, Honorable Chairman.
Honorable Maneli, take the floor.
Chairperson, I think I would like to remain with my video off, and also greet Chairperson, honorable members of the committee, Deputy Minister, and everybody in the meeting. In as much as Chairperson, we got the report, both reports. Probably we need also to start by acknowledging them, and as a positive note, in terms of the transformed organization of the board, GEMS, also acknowledge the issue of the balance in the gender there. Probably with the note that the previous speaker alluded to the issue of the disability. Can you also be clarified as to why is it not covered, or if it is covered? Chairperson, coming to my questions then, Chair. I think in terms of the housing scheme, can we be told that since they are unable to verify withdrawals on individual linked saving facilities, as they are submitted directly to the National Treasury, how do they plan to resolve the challenge, Chairperson? Also, since the department does not at the moment comply with the Financial Sector Conduct Authority regulations regarding mortgage organization, how is the department going to address this situation? And also, if GHS will register to comply with the Financial Sector Conduct Authority, will it not be encroaching into the banking sector, the banking sector's area of operation? Then, Chairperson, when it comes to to James. I think honorable members have covered all other matters that I needed to speak on. So in terms of us not repeating questions, I will say, Chair, I'm covered when it comes to James. Thank you, Chairperson.
Honorable Kondwe.
Yeah, Leboga Chairperson. Chairperson, I have a number of questions, and let me start by welcoming the presentations. I have a number of questions for James and just one question for the DPSA regarding the housing scheme. With respect to James, in slide 4, they provide that a response plan was put together to address the interim findings that warranted or merited action. And I wanted to find out which of the interim, findings, that were contained in the interim report did not merit or warrant action, because my take is that an investigative report, whatever findings are contained in that investigative report, all of them merit or warrant some sort of action. The second question pertains to slide 5, which states that James has adopted an open door policy, and the policy has resulted in engagements between the scheme and health providers, and these engagements are continuing. And I wanted to know whether these engagements would come to an end or whether this would be a continuous thing, because I think it's very important that they be continuous engagements between the scheme and the service provider to ensure that there's no misunderstanding or miscommunication when it comes to how the scheme operates. And then in slide 10, they indicate that the complaints or allegations leveled against the scheme by service providers, they outlined what those complaints or allegations were and how the scheme has been able to respond to some of these complaints or allegations. And I'm particularly interested in the first and the second complaint. In the first complaint in that slide, which was a complaint against the aggressive, impersonal, and threatening nature of communication. And how the scheme has responded to that is that they no longer subject claims to investigation, or and correspondence doesn't make reference to investigations. It just says that the claim is under review. And I wanted to know whether it's one thing to change the terminology of how you're going to deal with a claim or from a service provider, but are you not calling it an investigation, but you're still treating it as an investigation? Because it's very important that when you use terminology speaks to how you would treat something. So I think my question is simply this: in now not informing service providers that claims are now subject to investigation but are under review, are you then treating such claims as not being under investigation and under review? Because the methods in which you deal with those claims have to speak to the manner in which you claim to you state you're going to address those claims. And then coming to the second complaint, which related to the scheme using a blanket approach in consideration of cases, and the scheme indicates that they've responded to that particular allegation or complaint by considering each case on its merits. And I wanted to know how it does that now, and how it's able to use this tailored approach, and whether human intervention is also involved in terms of this revised approach to dealing with claims and moving away from a one-size-fits-all or blanket approach. Now, my question to DPSA is one, as I indicated. My question is around the 700 million that is forfeited by employees due to non-compliance with PSCBC Resolution 7 of 2015. I wanted to find out what constitutes non-compliance, and what sort of action would necessitate that employees forfeit whatever contributions they're making. I'm worried because there's a resolution that penalizes employees in this regard and results in them forfeiting what is clearly their hard-earned monies and contributions. But I also welcome that research will be conducted on the effective use of the forfeited funds to the benefit of employees. And I'm also comforted by the fact that employees who forfeit their money through no fault of their own, through the fault of HR processes, will identify, and there's a process underway to look into paying them out. And I wanted to know how soon will they be paid out, and how were they identified? Thank you very much, Chairperson.
Thank you, honorable members. I'm now going to allow responses to the questions that were raised, starting with the. Oh, you were out.
Yes, Chair. I've been in and out, and I'm sorry if.
Okay, no. I've seen that. I will allow you, Honorable Ngcukaitobi, to put your questions, because I could see that you are in and out.
No, thank you very much, Chair, and good morning, honorable members and colleagues. Chair, you will bear with me if I then repeat what have been asked by honorable members, because I was in and out. I don't know today. There's a network problem in the area where I reside in Gauteng. But let me welcome the two presentations from GEMS and also from the DPSA. And I've got only a few questions, Chair, if I don't repeat what have been asked by honorable members. But what is important, Chair, is that from the GEMS, I know that the medical schemes are meant to protect the interest of members at all times, and as such also to improve governance of schemes, that members and consumers are adequately protected. And it has been touched by or highlighted by the Advocate Ngcukaitobi report as well. But I know that, Chair, with regard to GEMS, especially the Section 59 response plan that has been developed and implemented, highlighted in slide 11 in the presentation from GEMS, Chair. But my question then I want to understand to GEMS, if then what has been presented in slide 11, where all stakeholders consulted in terms of developing the response plan for Section 59 report? And if yes, how will then GEMS minimize an abuse of the implementation of Section 59 of the Act? And the second issue, Chair, I know that there is a column where there's a progress update, and of which that spoke about fraud and wastage and abuse. I want to understand also to GEMS if what has been done, in fact, to strengthen their system in order to avoid GEMS members and health providers to collude in commuting fraud and wastage and abuse. And lastly, Chair, my question will be then on the DPSA, especially the GEHS. I understand there's a slide that spoke about them unable to verify withdrawals on the individual linked savings facility as they are submitted directly to the National Treasury. How does the GEHS plan to resolve that challenge, Chair? I think those are the three questions, Chair, that I wanted to raise, irrespective of myself in and out, going in and out of this meeting, Chair, because of the network. Thank you very much.
Thank you. Can I now allow for response to questions asked by honorable members?
Chairperson, it's Dan Malawi from GEMS. Should I go first?
Yes, you can.
Thank you very much, Chair. Chair, the first question was from Honorable Ntuli. If the question was, can James tell what is it that was lacking that led to inequality? Could it be that, and this is how I understood the questions, could it be that the health providers did not have the same background, and maybe that may have led to them being treated differently? So and I need to explain this, Chairperson, that there is no way where we say at GEMS, and we have said in responding to the interim report, what we want to do at the Government Employees Medical Scheme is not to try and be defensive and say, no, we wanted to look at this as objectively, and they said, what is it that is identified in the interim report? And I keep on stressing that this was an interim report, and this will become relevant when I answer other later questions. That what are the things that have been picked up that we can immediately start saying, probably we are not doing it in the best way, but how can we improve? So when claims are submitted to the scheme, all claims are treated the same, because we do not say this one comes from this type of provider. It's practice numbers that are used to pay claims. However, the healthcare providers who raised these things, maybe they were experiencing these things in various forms. No, it may not necessarily be from GEMS. And that's another point in our response. We said the feedback was that GEMS, and then it mentions other two providers, to say that these were found to have had bias against the providers. So there was no intent, and I made this point. However, we said, what is it that is coming out of the report that we need to look at? So what when it comes to the training of the doctors, I cannot answer that could have influenced. Doctors are trained by medical school to become clinicians. And this is also mentioned somewhere. One of the things that we have engaged with the doctors is to, when they become practitioners in private practice, there is another skill that we also are, and we also assist them with, which is practice management. And claiming from medical schemes is not taught at medical school. But what we do, once you become part of our provider network, and we have what we call a provider relationships unit, where we constantly meet with the doctors and we talk to them about the issues of training, of claiming. So this is something that you learn when you are in practice, and I hope that then answers that question of whether there is a standard of training. And then the next question is, after the complaints, does GEMS have a yardstick to us to check the status of fair treatment? I reiterate again that at GEMS, we treat all healthcare providers the same. We have a responsibility in terms of the constitution of this country. We cannot be seen to. So in the processes and the systems that were being used to identify the outliers, what happens is that a lot of healthcare providers that see GEMS members happen to be Black healthcare providers. So sometimes natural what will come is that the majority of the numbers maybe who are being investigated, they happen to be Black. And the report did say there is no intent. However, they show bias. They show bias in the outcome, but there is no proof of intent to racially profile. And that is the thing. If you look at the summary at the end of the interim report, that's actually what it says. It talks about confounding factors as well. So I think we need to understand the interim report in that context of saying, while the bias could be shown by the outcomes, there is nobody who was intentionally doing anything. And that is stressed. It is really what Advocate Ngcukaitobi and the panel were saying. The next question from Honorable Ntuli was that, can GEMS tell the specific parts that have been improved? And in the presentation, we did talk about this. We went to look at the policies, the processes, the SOPs. And then we said, is there anything in the standard operating procedures, whether it be the algorithms that are system driven? We went to look, the other process is whistleblowers. We checked all of these things and compared against the interim findings to say, what is it that we can improve? So in general, we looked at all of this and we checked against the interim findings and said, what is it that is in the interim finding that we could improve? So it was a general approach of improving overall based on reading the interim report, and I have alluded to that in the presentation. Then Honorable Kibi. So the question was that whether there was a situation where we found that there were definitely racial bias. And I again indicate that our processes were such that we don't say Dr. Stan or Dr. Joe or Dr. Cindy So is of which color or creed. Claims processing is based on practice numbers, and we did submit this to the investigation. The biggest problem always came with the fact that when it was checked who is under investigation, it was found that from the medical schemes industry in general, it seems to be that more of the Black doctors are the ones who are being investigated. So that is when Advocate says the outcome shows bias. However, there is no evidence of intent. So that is what I keep on saying. And we basically did not go and argue and say anything. We said, oh, if it says that, what is it that we can do to try to show that we deal with these things that are being raised? And that is the important thing. The next question from Honorable Kibi was that, what is the turnaround time of payment of healthcare professionals? 95% plus, 95 point something percent of claims are paid within 30 days. Of healthcare professionals are paid within 30 days. The plus minus 5% that is not paid within 30 days, it's usually those claims that have got some queries where you find that there are certain things that need to be clarified. And then most of the claims will then be paid within the next 30 days, which means most of the claims that are valid are paid within 60 days. But the majority, more than 95%, are paid within 30 days. And the requirement by the Act anyway is that we should pay claims except for those that may have queries within 30 days. And we comply largely while some may have queries that need to be found out, to be paid. The next question then is, did GEMS reprimand the officials found to be racially biased against Black health care professionals? No official was found to be racially biased against healthcare professionals. I explain again, Chairperson, that the report found that in the processes that are undertaken by by the industry, and the three GEMS was mentioned with the other two entities, that racial bias was found in the processes, in the outcome of the processes. However, no intent was indicated, and I keep on referring to this because this is very important. So, as a result, Honorable Kibi, there is nobody who needed to be reprimanded. Honorable Motsipe then asked, does the board have persons with disabilities? Chairperson, allow me to briefly explain how the board of GEMS is chosen. The board of trustees of the government employees medical scheme is made up of 12 individuals. 6 of those individuals are appointed by the Minister of the Department of Public Service and Administration, who is the employer and the principal. We refer to the minister and the DM taking care of the portfolio is our principal. They choose based on the scheme rules and the provisions of the Act, which require that people who are appointed must have certain skills. And these skills are actually specified in the scheme rules. So that then half of the board, which is 6, is appointed by the minister. And as I indicated, in this case, that is delegated to our deputy minister who's taking care of the portfolio. And then the other 6 are elected by the members of the scheme in an election process. And the term of office is also specified in the scheme rules for all the board members. This is so the board adheres to all these provisions of the scheme rules, which are aligned to the provisions of the Medical Schemes Act. And that is how the board is chosen. So it is very difficult to unless the members are so that maybe I should put it that is how the board is chosen, and I hope it answers how the board is constituted. And then Honorable Motsepe then also spoke about the allegation that pharmacists reduce the tablets that are given to members. It's a very difficult one for us, and it refers exactly to what this issue of fraud, waste, and abuse is all about. If that is the case, that Honorable Motsepe was talking about. So we try our best to ensure that, as I indicated, one of our responses to fraud, waste, and abuse is education of our members. So if that is a problem that arises, then the issue of checking whenever one collects medication to say, check my medication, it's very important. You requested, Honorable Motsepe, that the scheme should investigate this. This type of things it's only when members show evidence with the scheme that this happens, that the scheme will assist and engage with the pharmacist. So it's those areas where there has to be collaboration between the member and the medical scheme, because we don't know what happens out there. That is why people often ask me, what is the reason why there's fraud, waste, and abuse? And I say, it's because we are a third-party payer. A person receives the service, a claim is received by us, and we pay it on trust. If you go to the supermarket to buy a loaf of brown bread and pay 5 rand for it, you see the loaf of brown bread. In our case, because we are a third-party payer, we rely on the claim. We haven't seen what our members have received. And only if our members inform us that with proof that we did not receive the service, can we do something. And that is why there's this fraud, waste, and abuse that can happen. The next question was that GEMS had more than 1 million members. What happened to those who have left? Honorable Motsepe, GEMS, I can assure you, has not lost members. Maybe there was a misunderstanding somewhere. GEMS has over 770 principal members, 770,000 principal members, which are the employees and pensioners of the who were employed in terms of the Public Service Act. And we are the scheme that continues to grow. those with 700, in all, we have over 2 million beneficiaries. So we cover the health of over 2 million beneficiaries. In the past 2 years, and particularly in 2020, when COVID was at its peak, GEMS was the only big, among the largest medical schemes that grew. We grew by about 70,000 beneficiaries, 70,000. It is the only big medical scheme that grew. The industry actually lost members during that period. So we are actually continuing to grow as we speak at the moment, despite that the economy is putting a lot of pressure on everybody in the country. So I just wanted to clarify that there is nothing that we haven't lost members. We only went through a period around 2016 where we had a dip, but since then we've been growing. Honorable Maneli indicated that all her questions were answered, were covered. Honorable Gondwe, slide 4. Why do we have those that we say are findings that are warranted, warrant to be responded to, those that have merit? What do we actually mean? Can I just, let me again restate that, yes, as you indicated, Honorable Gondwe, this was an inquisitory panel. The section 49 was an inquisitive investigation. So what happens is we have an interim report. As I indicated at the beginning of the presentation, we then were given a chance to respond to these interim findings. We await the final report, and we don't know whether the panel may change some of those after they consider our responses. So when we say that there may be some that warrant merit, we basically are saying that you may find that we have addressed some of the questions that were being asked that led to some of those interim findings, and they may change. And then when we will study the report and then accordingly respond. However, as advised by Advocate Ngcukaitobi, we immediately started looking at this report and say, what are the issues that are being raised here? And we started dealing with them. So that is what we mean. So then the next question is, James referred to an open door policy. And the question was that, will these engagements come to an end or will they continue? We actually have, even before the section 59, we already had what we call a provider relations unit, which is headed by a senior manager, and all of us are engaged. We engage with the healthcare provider all the time. In fact, we have been doing this since GEMS was established. However, what we basically found out with these complaints was that despite the fact that we meet with, whether it is all these advocacy groups, so let me not mention their names, I may leave out some of them, but we meet with all of them regularly, and we continue. We have every year we have a schedule of meeting with the healthcare providers. But what then happened is that there were those who had complaints, and we had to address these complaints that we had listed in the presentation. So what we basically meant is that outside even the work that we're already doing and that we continue to do, we had to have an extra effort to address some of these complaints. So that's what we really meant. But yes, for as long as we exist as GEMS, we will continue, because we will continue to meet with the healthcare providers, because they see the members of GEMS who are their patients. And then in dealing with the slide 10, complaints against the scheme, we needed to state the complaints as they came out. So the question was, why is it that we are changing terminology? Could it not, for instance, when you say we are no more using investigation in our terminology? Now, I need to explain that this is important. I'll be brief, Chair. when you say we've got an investigations unit, immediately people say we have referred you to the investigations unit, and then it investigates fraud. People start saying, oh, it means they think I'm a fraud. I may be a fraud until I prove that I'm not. So what we applied our minds to that in terms of what the healthcare providers were saying. They're saying, when you say you're investigating me for fraud, it immediately taints me as a healthcare provider. So rather, we then said, okay, let's use terminology that does not insinuate, while at the end of the day, we are still doing the same thing. So for instance, instead of saying it's a fraud unit, we say it's a claims risk unit. It lands better than when we use we're investigating you. And that was really the intent. But the outcome based on evidence at the end of the day will be directed by policy and law and all of those things. So that is the intent of, and the report also suggested that. And then the blanket approach, the revised approach was basically saying, we're restating the fact that we don't say healthcare professionals in general defraud the medical schemes. That is not true. That's not the case. The majority, in fact, the overwhelming majority of healthcare professionals are doing an honest job, claiming properly against. There is a small, very small percentage of those who take chances, defraud, and do all. And then, unfortunately, that because it's a wrong activity, it gets attention. The last questions, Chairperson, were from Honorable Ngweba, where slide 11 talks to the governance of medical schemes and always acting in the best interest of the scheme. And the question was, were all stakeholders consulted when we came up with a response plan? And the answer is, we draw these plans, and then yes, we talk to and present and report and take counsel from our principal, which is the ministry, and in this case, the DM gives us counsel. We present what we intend doing, and then we get counsel. So, and then we also, GEMS is a product of the PSCBC and cabinet decision. We consult extensively at the Public Service Bargaining Council. Actually, we have what we call a GEMS PSCBC Joint Working Committee, which always addresses the issues, and we present the work that we do. We report regularly at this forum. The last question, Chairperson, was, what has been done to strengthen the GEMS system so that fraud, waste, and abuse does not recur? And I think in the presentation, I did allude to this to say, what we have done is that we have looked at the systems, those ones, the ones that do the algorithms. Now people are talking about artificial intelligence. These are the ones that do claims trend analysis. And then we look at that. And then what I said in that slide, I indicated that we have now allocated senior GEMS officers who have got the expertise to analyze what comes out of these systems. There is a slide actually that alludes to that. And then I also indicated that we looked at the policies and the processes, and our SOPs have been revised, taking into consideration the things that were said in the interim report. Thank you, Chairperson.
Thank you. Can I now invite the department?
Thank you, Chairperson. I will actually give the opportunity to Government Employee Housing Scheme to respond to the questions that have been put forward by the members of Parliament. But just as an addition to what Dr. Mulabi has just responded to in terms of GEMS, is that we have actually taken into consideration all the concerns that have been expressed. We will continue to monitor the discriminatory practices that have actually been unearthed through the Section 59 Inquiry Interim Report. the inequalities and discriminatory practices that still exist within the scheme. We will also continue to monitor, we will continue to monitor the procurement and financial control management system of the scheme. The claims, we will continue to look at personnel in terms of skills and expertise. When it comes to appointments, the representativity thereof, gender representation, youth, disability, including vetting, because ethical issues is one of the things that always need to be taken into consideration whenever we have to appoint, so that we can try and nip anything that can be corrupt practices of the future in the bud. Maybe when we talk about the outcomes and say that the outcomes show bias in terms of the report, however, there's no evidence of intent. And I do understand the sentiments that have been expressed. Maybe it's about us saying that the outcomes shows bias with hidden intent. And in that way, it will actually help us to manage to actively work on this in a way that there isn't really going to be any discriminatory practices that are actually going to be taking place. It will be, Chairperson, a sad day that Black people experience oppression under our guard. Taking into consideration that Black medical practitioners find it difficult to thrive in this industry, most of whom have already committed suicide. And maybe these are some of the things we need to develop interest in, to want to have the statistics, so that when we talk about these things, we understand their implication and understanding our role within the state, the kind of difference we need to make in the lives of South Africans at all levels. And one other thing is that when it comes to bargaining, especially for medical practitioners, we must consider that they are not actually represented at the bargaining counseling, the PSCBC. And this is why, therefore, sometimes you're going to find that issues that affect them directly are going to be left out. So basically, for all intents and purposes, Chairperson, what we are saying is that we do hear the sentiment of the Portfolio Committee. It is in our interest to get the scheme running properly in a way that is representative of all who participate in it and all the beneficiaries of the scheme. I thank you, Chairperson. Let me take the opportunity of giving GEHS the platform so that they can actually manage to respond to the questions from the members of Parliament. But also, when it comes to GEHS, in terms of forfeited funds, I think we need to look at it from the perspective of the public service regulations, because we have public service policies that makes employees to forfeit benefits under certain circumstances, like being found guilty of fraud and corruption. And these are measures that sometimes are actually utilized in public service to utilize this forfeiture or these forfeitures as a deterrent, so that we try and limit corruption within public service. Over to you, DG.
Thank you, Deputy Minister. Chairperson, I have two colleagues who are with GHS in the department who are in the meeting, Ms. Kelly Mkonto as well as Dumisani, who presented. I'm going to ask them to answer the questions, and then I'll come back and close any gaps that some of the questions they may have left out. Kelly, would you like to start answering questions that you can answer?
Okay. Thank you, DG, and good morning, Chairperson and honorable members. Yes, I'll answer some of the questions, actually most of the questions asked. I noticed that most of the honorable members asked the same question, around the forfeited funds and also the old housing allowance. So around the forfeited funds, this is governed by a resolution that was signed by both government and Labour. So Labour agreed to some of the conditions that were put on the PSCBC Resolution 7 of 2015. And one of them is that if an employee resigns or maybe the employee is dismissed, they will forfeit the funds. You must also bear in mind that the sole purpose of introducing the ILSF, the savings, was to encourage government employees to buy houses. So it was to promote home ownership, because people were getting the 900, but the money would go into PESAL, and it becomes part of the budget, and they end up really not utilizing it to actually buy houses. So they introduced this culture of savings in the public service. And since they introduced it, a number of government employees are now able to access their savings and buy their houses. So now, in terms of the first question of those who passed on, when they introduced this in 2015, employees were encouraged to register. You have to apply for your housing allowance. It's not an automatic a benefit. So when onboarding by the HR practitioners in departments, the employees are encouraged to fill in the forms and also enroll on the GHS system. So we have found that, and in fairness to the employees really, that the HR practitioners are not actually educating the employees properly. And in terms of onboarding, they don't assist them in filling in the forms, applying for the housing allowance, and also enrolling on the GHS system. So you will find that those who are getting the 900, they continued getting the 900, but they did not apply when the resolution was signed in 2015. So they'll continue getting the 900, and they are now losing out on the savings, because you see the housing allowance increases at CPI every annually. So they're losing out on the increase. The 900 they'll continue getting the 900, but they're not saving the difference. Now the housing allowance has increased to 1,500. So the 600 rands is not saved because they are not aware of this added benefit. Or maybe there's also elements of lethargy. They've just felt we've been receiving this 900 and we just do not want to, we're not interested in continuing. It's a problem because later they may want to really just access their savings and they'll find that, they have not been properly educated around the savings. So those who joined the public service after 2015, the full amount, the full 1,500 is saved for them. And when they are ready to buy houses, they access the full 1,500. But those who've been receiving the 900 will receive and save the difference between the two. And I looked at the questions. Most of the honorable members really asked around the 900 rands and why officials still continue. And I need to also indicate that we are also on a roadshow to educate employees because we have actually identified this as a problem. And HR employees, others are new employees, they are not aware of these resolutions that were signed. So we've taken it upon ourselves to go on a roadshow now. We go to provinces and we also have online education with government departments, educating them around the importance of applying and also enrolling their employees. Now, the other question was what happens to the funds of those who have passed on? We have issued circulars and departments have responded, and those who have actually applied and submitted all the necessary documents in terms of their beneficiaries, people who are supposed to benefit from the passing on of the of an employee. Necessary documents are submitted to HR departments, and we're trying to correct that anomaly of really not enrolling the employees and not. Some of the employees, it's not due to the fault of their own, it's because they were never really educated around this. So we cannot penalize them in terms of accessing their savings. And we agree that these savings belong to them, they are rightfully theirs. It's only those who have been dismissed or maybe resigned from the public service forfeit the funds. And around the issue of us being not being able to verify the ILSF withdrawals, I think the DG spoke to it earlier on in terms of the decisions that we have now taken in terms of the institutional form of GHS. As soon as all those things are addressed, we'll be able to attend to just a number of the areas that we are unable to address, and also the issue of mortgage origination. We are unable to do that. Honorable member asked that, what will happen to the functions of the banks, because some of the requirements, require us to be registered. It's not only the banks, but if you are in the good standing and you qualify for that registration, you'll be able to do mortgage origination, and you'll be able to counsel, assist with the rehabilitation of those that are indebted. So these issues will be properly addressed as soon as we finalize issues around the institutional form of GHS. I think I've covered most of the questions, because in the main, most of the questions were just around the 900 and what happens to the forfeited funds. Thank you, teacher.
Thank you, Kelly Dumisani.
Thanks. Thank you, DG. There is a question from Honorable Kibi around the issue of the service provider to undertake research regarding forfeited funds or the savings. In brief response, there will be a process internally in the department to deal with that, and once processes are concluded, we'll of course update the committee. There is also a question, Mr. Chairperson, that was asked by Honorable Dr. Gondwe regarding how soon will payments be effected for those who exited. I need to indicate that the Director General has already signed off processes for such payments to be effected. We're just waiting the other arm, that is the National Treasury, to finalize their processes from their side so that payments can be effected. Thank you, Chair, and thank you, DG.
I think the one question that has not been attended to, I'd like to attend, is the one around compliance with the Financial Sector Conduct Authority. Won't we be encroaching on banking sector areas of operation if we comply? What I want to highlight here, Chair, is that currently the work for government employee housing scheme is done within the department. There is a chief directorate within the department that's doing the work, and the home loans issues are managed via the contract with the South African Home Loans, which was signed some years ago. So at this stage of our operations, we are not required to meet any requirements of the Financial Conduct Authority as the DPSA because of the level of engagement. However, there is the talk about GEHS being a standalone entity, which is an issue that I reported on earlier on, that we are working on that with Treasury and other related parties. And once that kicks in, and there is an expectation that that standalone entity will also be introducing various packages of home loans for employees in the public service, because Labour has indicated that they don't want this work to be outsourced to financial sector institutions, but they want government to be responsible. Because once you outsource to banks and etc., like the home loans currently, then there is a cost to it, and it becomes unaffordable to employees. This is according to submissions that have been done by Labour to the department. So when in the formation stages of the entity, and when we reach that stage, we will deal with the issues around how such an entity relates to the financial conduct issues, to the financial sector, and what responsibilities it takes and what responsibilities it doesn't take. and lots of consultations with Treasury as well around that particular approach are going to be necessary. So at this stage, we are not in non-compliance of anything, but in future, if we move into an entity and there are a financial conduct authority issues that we have to deal with, certainly there must be compliance in respect to those issues. I just wanted to clarify that. I think that there's a question to Misani that was not answered, and I would like you to answer it. It's around the inability to verify withdrawals. How are we going to resolve this issue? This question came from two members, I think Honorable Mkweba and Honorable Maneli. Unless I missed it, I didn't hear you colleagues answering it. I think maybe please give it a shot and just answer it.
Thanks, DG. Respectfully, Kelly did respond to this question by Honorable Mkweba and Honorable Maneli. Yes. Maybe she can just summarize quickly again, Kelly.
It's fine. I think if it has been responded to through you, Chairperson, can we take it that we have responded?
I agree, DM. Thanks.
Thank you, honorable members. Now we go to the last agenda item, which is the report of the oversight. Can Mr. Ngcukaitobi deal with that?
Thanks, Chairperson. Let me project the report. Okay. Good morning, Chair, and honorable members and colleagues, and good morning, greetings to the Minister. Honorable Chair, the Portfolio Committee, as you are aware, we are all aware that we undertook an oversight to Gauteng on the 19th to 22 of April 2022. We have compiled the report that we are presenting here before the committee. I won't dwell much in terms of reading word by word from the document, but the main purpose of the oversight was to conduct an oversight visit to the office of the Premier in Gauteng to discuss the state of the province concerning the administration and governance matters, with a focus on service delivery improvement plans, the tuition service centers, payment of service providers within 30 days, and frontline service delivery facilities. And then we have conducted unannounced and unannounced visit to hospitals and then home affairs. And then after that, then on the Public Service Commission as well were invited to this oversight. They've provided a report called the State of the Public Service in the province, together with the workshop that we attended on the last day. Chair, I will just browse page by page. If members, because today's report has been circulated, timelessly, the members will shout if there's anything that they would like to correct on the report that we are presenting here, so that I will only start going word by word when we go to the recommendations and the observation.
Sorry, Honorable Chair. Can we just?
Yes, Honorable Kibi.
Yes, it's very small. Can it be enlarged, please, Chair?
Okay.
Nambe nyamelezele nje andiboni apha.
Oh, okay. Let me try to enlarge it. Otherwise, we will strain your eyes. trying to get the future for enlarging you.
Julius.
Yes.
It's normally on the bottom right corner of the Word document.
Yeah, just that my computer is okay. I got it. Yeah.
Yeah, that minus and plus thingy thing.
Okay.
Yeah.
Okay, here's the report, honorable members. I've enlarged. I think now it's more clear and visible. Yeah. Okay, so members, as I've requested that I'll just go page by page, slowly page by page. And then if there's anything that you have noted, just raise through the chairperson so that we can either correct it or maybe put it on hold up until the committee consider or adopt the report. So this is a page 1, honorable member. In our page 2, this is the delegation that attended the entire oversight. Including the officials from the department and the office of the premier. And this is where then the main oversight started, where we started with the meeting with the Gauteng office of the premier. It was a boardroom meeting for the day, for the whole day. Page 4. And page 5. Page 6. And page 7. And page 8. And 9. Page 10. Page 11. Page 12. Page 13. Page 14. Page 15. Page 17. Page 19. Page 20. Page 22. Page 23. '24. '25. And this is the workshop that we attended on the last day for Public Service Commission. Okay. Honorable Chair, then now I can go through the observations and key findings. I don't know if members will also want me to read, or should I then zoom straight into the recommendations, because I believe members they have read them. Chair?
I think let's go to recommendations.
Okay.
Chair, Honorable Chair.
Honorable Kibi?
Yeah, and I just want to request the Honorable Chair, for the benefit of those that were not part of the oversight, why can't we start with the observations and then go to the oversight?
Okay.
Yes.
No, I'm also amenable to that, Honorable Kibi.
Sorry, Chair. Sorry, Chair. I just want to confirm if we should continue to be in this meeting as the department.
Yes, sorry. I should have released you.
Okay.
Thank you, Chair.
I should have released you. Sorry for that.
Thank you, Chair.
Thank you, Chair. We will
But Chair, through you, we are together with the department. What we've observed there as the portfolio committee, I'm sure they should be aware of as well. But anyway, if they feel like leaving, that's fine.
Let's release them because they want to leave. Anyway, it's us who are playing oversight over them.
Yeah.
Thank you, Chair.
Thank you, Chairperson.
Kunjalo Chairperson. Mabazibone lezi zinto esithetha ngazo. Bye-bye ngalo.
Luhamba mamuntula nikwazi babophelele.
Okay, Chair and honorable members. Okay, I will start with the 5.1 observation and key findings. The committee appreciated a warm welcome by the Office of the Premier and the presence of all heads of the departments in the province. And all the HOD participated during the first day meeting to discuss the 30 payment of invoices, disciplinary cases, service delivery improvement plans, tuition service centers, and service inspection report by the Provincial Public Service Commission. With regard to 5.2, the committee emphasized the importance of the Office of the Premier in strengthening coherent planning, coordination, and monitoring performance of the provincial departments in delivering services to the citizen. And then in terms of the heading, the observations are mainly on the disciplinary cases. 5.3, we then said the provincial departments are not meeting time frames in finalizing disciplinary cases, and this cost government billions of rand, whilst employees are suspended with full pay. There was no uniformity among departments in approaching disciplinary cases. Some departments are using external legal practitioners, whilst others are using internal labor relation officers. And this has been flagged as contributors to time lag in finalizing the disciplinary cases within 60 to 90 days. And then 5.4, the disciplinary cases are not loaded on the PESAL system as a mandatory requirement of the Public Service Regulation 2016. And then with regard to the 5.5, there is a need to reduce the red tape in approving submission related to the disciplinary cases. And when, with regard to the 30-day payment to service providers, the committee found that the Department of Health and the Department of Infrastructure and Property Development have the highest backlog of the invoices paid after 30 days. And regression of both departments contributed to the substantial provincial decline of 28% in performance. And both departments owe 3 billion on unpaid invoices. And then with regard to 5.7, there is a lack of consequence management for non-compliance with 30 days payment. And the province has to urgently attend to duplicate payments, payment delays, and inaccurate accruals of the identified departments. And then 5.9, the failure to pay service provider on time impacts negatively on the service delivery. And the committee applauded the province for establishing war rooms to deal with outstanding invoices to service providers. And then with regard to service delivery improvement plans, the committee found that the committee took note of progressive submissions rate and compliance with the SDIPs. However, it was concerned about non-compliance by the Department of Health and the Department of Roads and Transport. And the committee noted the reason for non-compliance as both departments changed the champions responsible for SDIP. However, compliance is still expected. And then with regard to 5.11, the committee noted that some departments were not prioritizing the SDIPs as part of the business process to enhance service delivery. Officials deployed as champions of SDIP, particularly at the Department of Health and of Roads and Transport, should ensure they comply with the submission of the SDIP timelessly. And with regard to 5.12, there were some inconsistencies in developing credible and effective reporting and realistic SDIPs and their submission by the DPSA. This happened as a result of lack of monitoring of the SDIP by the DPSA. And then 5.11, the committee was concerned about the SDIP reports being used for malicious compliance without necessarily seeking to realize sustainable and meaningful improved service delivery. And the SDIP submitted are disintegrated from the strategic planning process of departments. And then with regard to tuition service centers, honorable members, the committee noted with dissatisfaction that some tuition service centers around the province have been changed to service shared centers under the municipalities due to inadequate funding. And the committee advised that having more departments in one-stop center would be beneficial for the community and would add value in enhancing service delivery and improving quality of life. 5.15, of all tuition service centers in the Gauteng province, only 2 have center managers. And then with 5.16, responsible departments, DPSA, COCTA, GCAS, have to conclude the reconfiguration or repositioning process in earnest in order to bring service closer to the people. The committee was dissatisfied with the slow pace in the repositioning of the tuition service centers. And then 5.17, funding and lack of connectivity are the main major impediments towards the success of the noble idea of the tuition service center as a delivery model. And then with regard to the Alexander Health Care Center and Clinic, is one of the facilities that the committee has visited. During the interaction with patients who were queuing at the frontline service of the healthcare center, people indicated that they were on the queue for up to 3 to 7 hours before acquiring healthcare services at the Alexander Health Care and Clinic. And the committee condemns such inefficiency in the healthcare center. And 5.19, aging infrastructure, which was not well maintained in the public health care centers, needs urgent attention by the national and the provincial health departments across the country, particularly at Alexander Healthcare Clinic, in order to avoid future disasters. And 5.2, shortage of staff in the healthcare clinic impacts on the quality of the healthcare services in the province, and this was due to the limited budget and some hospitals operating at 50% capacity. 5.21, filling of the vacancy in the Department of Health took longer than anticipated. And the Provincial Department of Health has to ensure that appointments of funded vacant posts are filled urgently within 6 months. And 5.2, appointments of interns across all frontline service department has to be prioritized in order to strengthen capacity in the public healthcare. 5.23, the management of utilization of leave in the healthcare sectors needs to be given a necessary priority, and the Department of Health has to ensure that leave applications do not compromise provision of healthcare services, and managers need to consider staff complement when approving leave in the healthcare centers. And the Alexander Healthcare Center needs to develop a standard operating schedule to manage queues across the center. Use of security officers for queue management has to be reviewed and assigned to queue managers. And then with regard to 5.25, security personnel was insufficient, putting health workers and patients at risk. And then we visited Captain Park and the Tshwane Department of Home Affairs Centers. These are the observation and key findings. The shortage of staff and inadequate budget are the major challenges impacting on the efficiency of the Department of Home Affairs. And shortage of staff results in long queues and employees fatigue. And then again, what we have discovered is that connectivity and system unreliability contributed to inefficient services and have impact on the queue management. And the IT system in Home Affairs Center needs to be improved. And the network goes offline, and this affects servicing clients in the front line. And 5.28, Home Affairs should continue with the mobile truck or office and visiting school annually for registration of ID for learners, and this will result in the reduction of long queues at the Home Affairs offices. Both Home Affairs centers visited by the committee were leased from private owners, which resulted in dispute over maintenance of the buildings. Then 5.30, we said the undocumented foreign nationals are putting tremendous pressure on service delivery and Home Affairs operation to process immigration services. And then with regard to the Department of Health, we have visited Tembisa and Mamelodi Hospital. That was an unannounced visit. It was discovered that it was discovered that a lack of regional hospital in the neighborhood of Tembisa and Captain Park makes Tembisa Tertiary Hospital attend and admit patients without referrals from regional hospital and clinics. And then 5.32, Gauteng government has to consider re-establishing Captain Park Regional Hospital to ease pressure on Tembisa Tertiary Hospital. And furthermore, it should build a new hospital around this deep slot to cater for the people coming from that side looking for healthcare services in Tembisa Tertiary Hospital. And 5.33, both Tembisa and Mamelodi hospitals complained about staff shortage, and staff complement has to meet the number of patients in per day in order to provide quality healthcare service. And with regard to 5.34, Tembisa Tertiary Hospital contributed 29 million to billions of rent incurred by the Provincial Department of Health regarding litigations. The majority of litigations cases emanates from cerebral palsy due to understaffing and fatigue encountered by health practitioners. However, some litigations are caused by pregnant women never consulting clinic or medical doctors during their pregnancy. And then when things went wrong, the hospital get expected to take responsibility. And this mostly happens with undocumented foreign nationals who seek services at Tembisa Hospital. 5.35, Provincial Department of Health needs to have standard operating procedure across all healthcare centers to manage queues. 5.36, we said the insufficient security personnel were cited in tertiary hospital, putting lives of the staff and patients at risk, and the hospital management have to be part of the process of appointing security companies in order to provide inputs on who best should be appointed in the healthcare facilities, as this was managed by the Provincial Department of Health. With regard to 5.37, the entire budget for the maintenance of hospital buildings get transferred to the Department of Infrastructure and Property Management, which is responsible for the maintenance. However, hospital management complained about encountering delays whenever they want to maintain their buildings, and hospital management appealed to have full control of budget on maintenance and to appoint or utilize internal staff for maintenance, which would be quicker, affordable, and cheap. And then 5.38, the management team in Mamelodi Hospital was commended for doing a great job to the hospital and to the Mamelodi community. The committee was pleased with Mamelodi Hospital's turnaround times to assist patients within 120 minutes and ensuring that the hospital does not have long queues in all departments. And 5.35, close supervisions of staff in Mamelodi Hospital has been used to reduce civil claims resulting into litigations. And the COA encouraged all front managers to motivate their staff by having employee of their month functions as a way of encouraging excellency in their departments. With regard to the recommendations, honorable members and colleagues, we have noted the following recommendations. One, for the Department of Public Service and Administration, that the DPSA should consistently monitor and assess effective implementation of the approved SDIPs to be in line with their annual performance plans. The DPSA should intensify its effort to address identified bottlenecks on the SDIPs and ensure resources are allocated to this activity. And the Department of Health should frequently monitor service delivery improvements and develop improvement plans. 6.2, the DPSA, COCTA, and Government Communication Information System should conclude a long-standing matter of repositioning the prison service centers in order to bring this issue to finality and ensure service closer to the people. With regard to recommendations for the Gauteng Office of the Premier, the following were made. That the DPSA, in collaboration with the Office of the Premier, should speed up the process of analyzing the disciplinary cases within reasonable period. And then 6.4, the Provincial Department of Health and the Department of Infrastructure and Property Development should, through the war rooms, work towards reducing highest backlog of the invoices paid after 30 days. And then 6.5, the Office of the Premier should ensure all service delivery improvement plans submitted to the DPSA are integrated and linked to the strategic planning process of the departments. And then with regard to 6.6, the Department of Public Infrastructure and Property Development, Provincial Department of Health, and the National Department of Home Affairs should ensure maintenance of government buildings remain a priority in order to avoid any future disasters. And 6.7, maintenance budget for the hospitals transferred to the Department of Public Infrastructure and Property Development should be reviewed in collaboration with the Provincial Department of Health in order to allow hospital management to be part of the process of appointing external service providers. And then 6.8, the Provincial Department of Health should ensure that the process of appointing security companies is inclusive by allowing hospital management to be part of the appointment process. And then 6.9, the Provincial Department of Health should work with the Center for the Public Service Innovation in resolving queue management in most of the hospitals, particularly in the Alexander Healthcare Center and Clinic. 6.10, the Department of Health should provide proper funding for hospital to fill all funded critical vacancies. There was a huge shortage of nurses and medical specialists in the hospitals. And 6.11, Gauteng government should reconsider re-establishing Captain Park Regional Hospital to ease pressure on Tembisa Tertiary Hospital. And furthermore, the Provincial Department of Health should consider building a new hospital between Diepsloot and Olivenhout Bush area to cater for the people going to seek healthcare services in Tembisa Tertiary Hospital. And then 6.12, the Provincial Department of Health should have a standard operating procedures across all healthcare centers in order to ensure uniformity of its business process. And 6.13, the Department of Health should introduce an IT system in hospital that captures biometrically the patients that routinely visit the hospital with a view to improving on efficiency of system regarding time taken by the hospital to adequately process each patient. And then 6.14, the Office of the Premier, working in collaboration with the National Department of Home Affairs, should open and expand more Home Affairs offices in the province. And cities such as Tshwane and Johannesburg should at least have 2 Home Affairs centers to provide services to the people in order to reduce long queues in the centers. With regard to the Department of Home Affairs, just only one recommendation. The Department of Home Affairs should improve its connectivity and improve on the reliability of the system in order to ensure efficient and effective services, which will contribute towards minimizing long queues. And the IT system at Home Affairs needs to be adequately improved and maintained. So, Honorable Chair and Honorable Members, this is the end of the report and the end of the recommendations. Thanks, Chairperson. Hello, Chair.
Okay. Honorable members, that is the report. Can I hear your views on the report?
Honorable Chair.
Yes, Honorable Kibi.
Yeah, thanks, Chair. I think the report captured everything that we have done and also our experience. And one would really say, Honorable Chair, it was really a good thing for us to go out and do the oversight, because in most cases, just receiving reports and not knowing what is practically happening on the ground is really one of the challenges. By going out, we are also encouraging this service delivery so that we can see people are really being taken care of. What you get sometimes on the reports, written reports, it's not what is happening on the ground. So from my side, I don't know from other members, I think this report has captured everything that we saw and what we also recommended on that particular visit to Gauteng. Thanks, Chair.
Thank you, Honorable Kibi. Any other input?
Honorable Chair.
Yes, Honorable Malomane, take the floor.
Thank you and greetings to everyone. Let me also say the report reveals even the challenges that we encounter. It is a true reflection of what has happened during our oversight. And I believe when we did the oversight, it shows us that it is really, really important when we got reports that are presented and then to go outside and check whether the reports are the true reflections of what they're saying. So I support the report. Thank you.
I don't see any other member who wants to to speak on this report. I can therefore say the report is endorsed by the committee. Unless there's a member who says no.
No, Chair, thank you very much. And let's appreciate that the report has been presented before this portfolio committee. And as such, Chair, I'm then supporting the statement of Honorable Maluman that we support this report to be tabled before Parliament.
Thank you, Honorable Ngcukaitobi. The report is now endorsed by the committee and adopted. I want to thank you all. I want to thank all of you, honorable members. We have broken a record today because we finished the business of the committee at 13 minutes past 12. Thank you very much, honorable members. Go well. Be safe. The meeting now stands adjourned.
Thank you, Chairperson Mandla.
Thank you, Chair.
Thank you, Chair.
Recording stopped.